I don't, there might be one copy short, so
And
somebody.
this is going to be live on YouTube, right?
Yep.
Sarah,
Yes.
with a PowerPoint for
There's
the visual.
an out. What you're getting is what everyone's going to
This
see.
didn't have visuals associated with it, so I did a Word document instead of a PowerPoint
For the YouTube.
for the
Presentation.
discussion.
Uh-huh. And that's what's on YouTube then.
I imagine they'll have that document, right?
Yeah.
Okay.
This is what will be on the screen. So when
Yeah.
if you want to
Uh-huh.
scroll down, just go like this, so you can two fingers down
Okay.
like that, and everything else should be just go find it.
And Sarah's over there.
Let's see.
Is there another copy? Or is
This is
Yes,
the
but I
screen.
need a little bit of help with this.
Okay,
I
pull up a chair.
usually use a mouse. Isn't that
Yeah.
terrible?
I hate those trackpads.
I can't. I get it so slow.
Oh no, you just do two like that.
Two fingers.
Yeah,
Okay.
up and down.
All right.
Yeah.
Let's just step right by me.
Okay, I'll be here.
Okay. All right. So this is an article in the New Yorker that Charlie and I caught our eye, and we were just floored by it. I immediately made a copy of it and put it on my desktop because it's quite shocking. And it's called The Whistleblowers, the Personal Toll of Exposing Fraud. So I hope this is beneficial for people who have not had the chance to read it. It's available online. It is the February 4th New Yorker,
2019.
2019, just came out a couple weeks
And the
ago.
cover looks like this. Oh,
Yes,
okay.
that's it. Okay, so the opening that I wanted to start with is that the government recovered nearly $2.6 billion from the healthcare industry in 2017, much of it thanks to whistleblowers. And it's an article that has a narrative about one of these whistleblowers named Darren Sewell, a 34-year-old physician who was working with the FBI to prove healthcare fraud at the insurance company where he works. And that company was called Freedom, based in Florida, and it has been making a large profit on Medicare Advantage plans. And it goes into a little bit of his history. He was a physician before he went to work at this insurance company. He was an emergency room physician and decided to go into industry and ended up at Freedom Insurance Company in Florida. Any comments about that? Those of you who have read the article, or I'll just keep plowing through and then we'll have comments in a minute. Sorry. Okay, this is a quote from the article, actually from one of the experts cited in the article. Institutional denial, obfuscation, and retaliation are hallmarks of many whistleblowing cases. And so the author of the article goes into the history of whistleblowing, and it's a very old one. In the United States, the first record of a whistleblower case was from 1777, when naval officers reported that their commander had been torturing British prisoners of war. And the commander then sues the officers for libel. They go to jail. And Congress then passed a law to protect whistleblowers. The officers were tried under the new law and acquitted. So this is, okay. The next case that we all know about is probably Serpico, where there was corruption in the drug control units in the New York Police Department. There was a film made about it. Then there was the Karen Silkwood case. She worked at a nuclear plant and discovered that the employees there were being exposed to radiation, and her employer was trying to cover that up. She had to blow the whistle. There was the case with Jeffrey Wiegand, who talked about Brown and Williamson, and he wanted to make it clear that they knew about tobacco hazards and that they knew about it for a long time before it became public. Sharon Watkins revealed accounting fraud at Enron, and Edward Snowden, of course, NSA spying on U.S. citizens. So whistleblowers are usually, but not always, employees or members of the group on which they're blowing the whistle. And once they do that, their lives are never the same. Here's some of the legal background that they have to deal with. When they make the decision to blow the whistle, there is something called a False Claims Act that allows private citizens to file suit on behalf of the government against anyone believed to be defrauding the government. The vast majority of these cases involve healthcare. Corporations are secretive about their operations, so fraud is generally uncovered by employees. If the government recovers money in a fraud case, a qui tam payment of 15 to 25% goes to the whistleblower. And finally, whistleblowers are basically unemployable once their role in the fraud case is discovered. And in this case that we're talking about, this was a young physician who moved over to industry. And they're kind of people that like taking risks. They kind of think of it as a spy adventure, as at least that's how they described his feeling about being involved in this undercover work. He kind of enjoyed it, but it does take a huge toll on them. And in recognition of that, they do receive a partial payment if the government receives a payout from the lawsuit.
Well, do you want questions yet?
Jump in, yeah, sorry.
Charlie
One of the
has
things I found really fascinating with the article is because of the complexity with health insurance claims, especially on Medicare, that the government doesn't know what they're doing when they prosecute these cases, so they absolutely have to have an insider. And these people wear wires, they go to meetings, they come up with all of this detailed research because they're there and they know it. And the government would be lost without them. It's fascinating, but the hell they go through on exposing the company it just takes a toll on their lives.
I think he started in 2002, and this case wasn't settled until 2017.
Well, and that's what I was gonna
Yeah,
say
yeah.
too.
It's
I was shocked at
incredible.
how long he worked under.
Sewell joined Freedom in 2007, but it was finally solved 10 years later.
Yeah.
So he was living almost like an undercover agent, and all the stress involved in that for all those years.
And I'm surprised it wasn't found out earlier within the company, that nobody suspected.
It was found out after a while, but the case was pretty close to being settled by then. But he was ostracized.
Yeah.
And then, of course, he ended up dying, which was very prematurely. But it's just amazing to see what the insurance companies would do. Remember, there was one part in there where they talked about how they, on the Medicare Advantage, they purposely hired teams of people to get sick patients off of their rolls.
I have a summary of all the types of fraud that they discuss in the article, and it's there's a little blurb. We're on a paragraph that starts with an analysis co-authored by Fred Shute, Center for Public Integrity, estimated that insurance companies had received nearly $70 billion in undeserved Medicare Advantage payments between 2008 and 2013. And as they pointed out, this is a vast underestimate because these people do stuff in secret. The link there is for a number of articles that is published by the Center for Public Integrity on Medicare Advantage-related things. The Justice Department is currently investigating United Healthcare, Anthem, Humana, Cigna, HealthNet, and Aetna, the major providers of Medicare Advantage. Peter Budetti, former head of CMS, which is tasked to oversee Medicare, said, "We have never been able to get a direct measure of exactly how much fraud there is. But one of the clearest indicators is that the more money is spent on fighting fraud, the more money is recovered by the government. So whenever they go after these companies, they end up getting something back." So why is there Medicare Advantage? Well, apparently...
Could I just add something?
Yeah.
Normally what we hear from our elected officials and those who complain about fraud
Mhm.
is fraud on an individual level.
Right.
And going to extreme measures like our governor has done in Kentucky with Medicaid. Very complicated red tape that consumers are required to go through to spend all this money managing the bureaucracy involved in trying to prevent fraud on an individual consumer level. We don't usually hear
Penny
about.
ante. Okay, so we're on the back here, and the reason for Medicare Advantage is that there was fraud in traditional Medicare. And as soon as that became clear, aren't there all these industries stepping up and say, well, we'll take care of that. We'll use the discipline of the market, and we will solve this problem. Okay, so what happened in traditional Medicare?
The problem on the level of the individual
Of the
consumer,
individual
not companies.
or the individual physician. Let's say there was an individual
Yeah,
physician
the
that was
non-for-
that was having unnecessary tests done,
Yeah.
but it's still retail. It's whether it's an individual committing the fraud in Medicaid or in Medicare if it was a physician, because they were only paid per service. So there were all these stories in the press about traditional Medicare physicians, over-prescribing tests and so forth so that they could buy the boat or
So the
whatever.
problem was in the fee for service
Right, and so
between the patient and the doctor.
Well, the doctor was overbilling by requesting too many tests and overdoing services.
Yeah, from a physician's standpoint, over-testing is in the eye of the beholder. And if you are Medicare and you're coming in to recover costs, you can say something's not medically necessary, where it's a matter of opinion. Our hospital in Ohio had tests in the ICU audited. And we had somebody come in and ketoacidosis and get admitted at 1 a.m. and they ordered repeat electrolytes in the morning. Well, in the morning was 5 a.m. when they drew it, so it's only 4 hours later. That's not necessary, quotes and unquotes. Well, yeah, it's okay to check that. And so, they came in and said, oh, we audited, 10 charts. One of them had, unnecessary, 10% had unnecessary tests. 10% of your lab tests in this hospital are unnecessary. We'll take a check next week. And gave them a fine of whatever, and they had to pay it. So that kind of thing, gee, they should have gone home a day earlier from the hospital. That was unnecessary care. That kind of thing with the retail. Now, there's the other end of that, of course, is the doctor who everybody that walks in the office gets every expensive blood test known to mankind and an MRI, and the obvious, overdone. But some of it in the past, and I don't know what's going on now, but some of the past has been quotes cracking down on what I consider legitimate judgment calls.
Is this
which is different from Medicare Advantage kind of?
Right. So this is under a
Yeah.
traditional Medicare reimbursement. Is that what?
Yeah.
Okay.
And there are bad actors out there. There's people
Mhm.
that
Right.
There always will be.
everybody gets. If you got an ultrasound machine in your office,
Yeah.
everybody who walks in the door gets an ultrasound. Well,
Mhm.
that's just wrong,
So as bad as that abuse is, the improvement is an absolute catastrophe. So here is a list of so Medicare Advantage turns out to be a new way to maximize profits. Okay, you have your lemon dropping, which is rooting out sicker, more expensive enrollees. You have your cherry picking, recruiting healthy enrollees who need little or no medical care. You have engaging in service area expansion fraud. In other words, let's say your healthcare company wants to expand into an area. They'll say all these physicians are on the list. misrepresenting the number of healthcare providers in its network in certain counties so that they can expand the areas in which they offer Medicare Advantage. And I've heard, haven't we heard here in a meeting of some physician that found himself on one of these lists and he hadn't even spoken to anybody about it? So they're just like,
Yeah, I don't understand this.
okay, so let's say in order to expand your insurance company into a new area, you have to have a roster of physicians that are offering specific services. There's probably a
They're
limit.
part of your network.
They have to be some specialists. That in order to get permission to offer a network there. And they'll just get this document together and put it out there, and then it turns out that those physicians are not actually in their network. They'll get the okay for the network, and then catch up or not with actually providing care to people and the physicians. Coding inaccuracies.
There have been areas where the insurance company basically it sends out a little letter, which they don't make real obvious. You're in our network unless you do this and this to say you're not.
Yeah.
Well, and people unknowingly are listed on the network, and that's happened.
And then what happens when a patient shows up at your door and presents that card that you?
Not that. Well, but they already signed up for the insurance. Their patient's stuck.
Yeah,
Remember, I
we're
told
not
you-
accepting new
At
patients.
that point, you wouldn't accept if you hadn't actually agreed to it. You wouldn't.
I've had that happen when I was in private practice, where we're listed
Uh-huh.
only when we're not on it. Patients snookered.
Well, and I think I told the story a couple of months ago about at my eye doctor, about the fellow standing next to me at the counter who had what he thought was a perfectly good Medicare insurance plan. I didn't see what it was. And they were telling him, yes, but it won't cover, his own eye doctor that he had come to before was no longer in the network of the plan he had. And so there he stood, and he said, well, I'll have to go to the bank then. I'll have to get some money to pay. So it was,
Part of it, insurance companies that list provider networks along the expanded thing. I've had patients who switched insurance and bring me in a list of docs. Well, who should I go see? Because you're not on my insurance anymore.
Mm-hmm.
This guy's been dead for 3 years. Probably not him. But that was the list of approved
Right.
providers.
right.
So they do play games.
It's a game, yeah. And then, okay, so what other thing they do is, the coding inaccuracies are almost always in the company's favor, resulting in higher government payments. One other thing you can do is increase the diagnosis codes in order to make the patients appear sicker. So you take a garden variety illness and parlay it into some rare thing that would be reimbursed at a higher level. That's another kind of fraud.
Because I heard of a case of a doctor that was saying this patient had cancer, and they were giving them chemo to make it look like in the end they were curing these patients.
What
Wow.
was that? I can't hear.
There was a case where this doctor was diagnosing patients as having cancer, and they were having them take chemo treatments. So in the end, it made it look like they were curing them of the cancer they had.
And that's poison.
Yeah.
That's real. He needs an attorney. Yeah, so anyway, okay, so then finally, after all these, then they go into detail in the article about how these frauds, the companies keep coming up with new ones. So the government investigators are always playing catch up, even if it's the FBI. They couldn't possibly keep up with all of the tricks that insurance companies can come up with to defraud the public.
Now, a little example of upcoding.
Mm-hmm.
If someone has coronary disease, they had a heart attack in the past, they had a stent. That proper diagnosis is coronary disease. Coronary disease with angina is a higher level. Well, people get upcoded with angina when they're not having angina is a symptom of pain. They get coded as having coronary disease with angina because they had angina once. They don't have it now, so there's they get, they're put up in the little higher payment group with that. That's a little example.
Yeah.
Angina is chest pain.
Yeah,
Just so
angina is chest
everyone
pain.
Yeah.
knows, because I didn't
Either-
know. It's
either
just
you
chest
got it
pain.
or you don't. Yes, pain. You have chest pain? No. Well, that's not a guy. It's not somebody.
Yeah, and I thought it was angina.
Well,
That's
people
what I
say
always
differently.
heard.
So back to our hero of our story, Dr. Sewell. Dr. Sewell's case was one of the first to show prosecutors and attorneys how Medicare Advantage could be defrauded. And then, as Charlie pointed out, Dr. Sewell died at age 39 as the result of a fall in his home. His fraud case was successful. Dr. Patel, the CEO of Freedom Healthcare, said that the fine against his company was a cost of doing business.
Yeah, and what was the amount of that fine?
6.2 million.
It wasn't very much considered what they got out of it. And it's just pitiful. What's going on. And no one's gone to jail. I think there were two Columbia HCA
Yes, two Columbia HCA
executives went to jail.
after Rick
Rick
Scott
Scott
bailed out of the
Yeah.
out of the
bailed out,
corporation,
got out.
and he's now a senator.
Yeah.
The
He's a senator, yeah.
Former
Former
governor
governor.
of Florida.
Freedom paid $31.7 million. And so the daughter of Dr. Sewell, who was his survivor, the whistleblower got a share, $6.4 million, which had to go to $2.3 million of which had to go to the attorney. So in any
The other
event,
thing I thought was really interesting is the whistleblower had to hire an attorney
of course,
to pursue this whole thing.
That's right. That's right. Well, if you get a chance to read that article, it is
it's a
fascinating.
very
Spellbinding.
it's depressing as all
Does
get
anybody
out, but
want
it's beautifully
this one?
written. Yeah, and by the way, I
you
believe
finished with
that
the issue?
it was sent around
Thank you. I
online.
like that.
It was sent
Wonderful.
around
Thank you.
online by Kay prior to this meeting as a
Yes,
as a
no,
Word
and-
document.
And I actually did it this morning and found it online. And just above it, you could listen to the audio online. So that was kind of, I just sat there and listened to the whole thing.
Cool.
Mm-hmm. Yeah, that's what I do too.
What's so clear is that we don't have any governmental way of controlling this fraud.
Right.
Is
Right.
that it's endemic
Right, right,
to the system,
right.
and that it works, and that there for the companies, and that there's no punishment
No.
for those
right.
who are found guilty. I know when Columbia HCA, they caught up with them because the New York Times did that analysis of how many people had the kind of pneumonia that was paid at a higher level. And I don't remember the exact figures, but it was something like, the incidence of that was like 5%, but in the Columbia HCA hospitals, it was like 99%, which was a clear, showing of fraud and upcoding. And yet the people who did that, who systematically did that, they have the algorithms written into their programs, don't suffer from it. They paid the $1.7 billion in the fine, and they used the money to go on and become a political figure. Rick Scott is now in the Senate, where he sits over, the decisions about Medicare, et cetera. So that privatized Medicare is just a fraudulent way of using healthcare to profit, and we have to find a way.
I mean,
When we talk about the amount of money that would be saved by going to single payer, that sum that is now being ripped off should be included in that. And I don't think that we do, because we don't know exactly what it is.
And it's just huge.
And it's huge.
that's a great argument against Medicare Advantage, though. And however many happy customers they have that get to go to the health club doesn't outweigh the fact that the government is never going to catch up with the fraud.
And it's billions of dollars that we're talking about.
Well, I mean, as I said earlier, I was surprised it took so long. And when I started reading the article, I was afraid, of course, the government was going to finally side with the insurers, you know, and so it's good to know that Sewell, you know, did, in the end, have, you know, was victorious, you might say, in the end, although his own personal story was so sad. But I just, and they did say that CMS just can't manage weeding out the fraud.
Oh, not at all.
They
Well,
don't
the other thing, I mean, if a physician is convicted of fraud, they get kicked out of Medicare.
There you go. That's
Okay.
right.
That's
There's a sanction.
There's a very meaningful sanction. Did this company get kicked out of Medicare Advantage? No, they just paid a fine and kept on slugging. You know, there's and that comes under that. And
Maybe that's one of the things we need to fight about.
Just one more
They need
bureaucratic
meaningful
level
sanctions,
in
yeah.
the system that's not
Yeah.
needed.
yeah,
And we've been throwing around the term CMS. Doesn't that stand
Center for
for
Medicare Services.
Medicare and Medicaid
Services.
Services?
Mhm. Yeah.
Center for
Yeah,
Medicaid,
that's-
Medicare.
Yeah, and so the official that's quoted was in a previous administration, and he's sympathetic to the problem. But the current person is what's her name?
Sela.
Seema. Yes, the Seema Verma, or yeah,
Seema Verma.
Seema Verma. I mean, that's quite a handle, but Seema Verma.
Who did she's the author of this new Medicaid program in Indiana, which Bevan is modeling that, of making people on Medicaid pay money or
The
get
accountability.
teaching them how to be productive citizens who do community service.
And this obsequious letter that our congressperson signed, along with 300 and whatever other people, was addressed to her to congratulate her on maintaining the integrity of Medicare Advantage, which is so popular among our seniors, and they would be bereft without
Well, I
it.
think a copy of this article could certainly be sent.
Should be sent
Yeah.
along with that. That's a good idea.
I mean, you know, we love him, but this was a real mistake on his part.
It's horrible.
Signing that letter.
Well, thank you for your attention. I hope it wasn't too
Thank
much
you,
of a blowhard.
Thank
job.
you.
Thank you.
Yes, very
Good
good.
job, Christine, and I think we should get a election committee report here.
Well, things are kind of tense over here, and
A drum roll!
I